Hello, everyone. Thank you for joining us in recognition of Heart Valve Disease Day, which was actually officially yesterday, February 22nd. But we're celebrating it today, and we're so happy to have you with us. Today, WomenHeart joins with the Alliance for Aging Research to bring you a conversation about heart valve disease. WomenHeart is proud to be a Heart Valve Disease Day partner, and we encourage everyone to learn more about it at valvediseaseday.org. Heart Valve Disease Day is about increasing awareness about valve disease, improving early detection, really critical in a valve disease journey, and ensuring that patients receive timely and appropriate care. Today, we're focusing on specifically the diagnostic journey of valve disease, how heart valve disease develops, how it is identified, and why it can sometimes be diagnosed much later than it should be. Valve disease often progresses gradually. Symptoms can be subtle, and in women especially, fatigue or shortness of breath may be attributed to lots of other things, stress, aging, menopause, other conditions, long before they arrive at a heart valve disease diagnosis. Earlier diagnosis, as is true for many diseases, results in better outcomes, which is why we're having this conversation with all of you today. So today we're going to talk about what to look for, how heart valve disease is detected, and how to ensure that it is not overlooked. I am joined by a WomenHeart Champion extraordinaire from the class of 2024, Kathy Larkin, whose journey includes valve disease and specifically bicuspid aortic valve disease. Welcome, Kathy.
Thank you, Celina.
So let's begin with your story. You had a heart attack years and years before your valve disease required intervention. How did that earlier experience of a heart attack shape the way you viewed your heart health in general?
Okay. Well, again, thanks so much. It's good to be with you today, and particularly today. I am celebrating, it was 4 years ago today, I had open heart surgery to have my aortic valve replaced. After a number of years of monitoring, I also had a couple of coronary bypass grafts at that same time. So for a whole lot of reasons, very happy to be with you today.
Kathy, it's a big day. It's your heartversary, it's your valversary. It's a lot of great things. So I'm so pleased that we're going to get to celebrate it together.
Well, can't think of a better way of celebrating it than with WomenHeart and all of the participants on the call. So I'm glad to be here. And as you said, I do have a bit of a journey with heart health. It actually started, there's extensive heart history on both sides of my family. My mom had very high cholesterol and passed that on to me. I have what is now recognized as familial hypercholesterolemia, which is a genetic defect in how our livers process the bad cholesterol, or LDL. And then I also have a blood clotting disorder. So as a result, I have premature atherosclerosis and at higher risk for early heart attack and stroke. On my dad's side, he had his first heart attack when he was 50 and died from his second at 61. In addition, a number of his siblings, unfortunately, also suffered from heart disease and died of the kind of one and done type of heart attacks in their 50s. So a lot of history on both sides of my family. I had a heart attack when I had just turned 39 in 1999. And at that time, I was in the best shape of my life. I was a runner, ran 10, 15 miles a week, and just was feeling good, doing my life, and didn't really think I had any issues. And then I had a heart attack. I was told, you got bad genes, that I had the coronary arteries of someone in their 70s, and it was recommended at that time that I have quintuple bypass. I ended up not going that route. I ended up working with one of the first of two just wonderful cardiologists that I've been blessed to know. And we ended up I ended up having a number of stents in the years that followed. And so for me, I've been under the ongoing care of a cardiologist since 1999. Always kept appointments. I follow recommendations. So in terms of kind of how that impacted my heart health, I've always tried to do my part things like, managing weight, exercise, blood pressure, cholesterol, those things that we need to do. And it's been an interesting journey in my years as a heart patient, seeing just so many changes in terms of heart health, in terms of diagnostics, medications, procedures. It really is a reason to be hopeful. There's so much available to us now that not only allows us to survive, but to thrive. But as you were mentioning earlier, Celina, it's so important that we catch it early. And I was fortunate in that we did. And also, to find a clinician who works with you in the way you want to be worked with, has the technical skills, but also you can have that partnership.
Absolutely. I think partnership is key, right, Kathy? When I think about when folks ask, yeah, my doctor's okay, or I always say, is he a partner? Is she a partner? Can you problem solve together? And I think that's really, truly what we not just should be looking for, but what we deserve as patients, and particularly women. So later, as you learned that you had heart valve disease, specifically this bicuspid aortic valve, which means that the aortic valve has 2 leaflets versus the typical 3. So when did you first become aware of that, and what symptoms were you experiencing at that time?
Okay. Well, as I mentioned, I was under the care of a cardiologist. I had an echocardiogram, that ultrasound of the heart, at the time when I had my heart attack, and then didn't have one again for a number of years. I had been told a number of times on exams that I had a heart murmur, and then at one point my cardiologist reran the echocardiogram, and the beginning of aortic valve disease showed up. And so at that point, it was really the combination of, I think, identifying the murmur and then also doing that echocardiogram that kind of put me on the path of monitoring this over the next several years. The interesting thing is I really didn't have any symptoms. I had for years what I think is classified as stable angina. It would come on from exertion or exercise, and it would ease off and go away. It was very predictable. I'd always discuss it with doctors, but it didn't really change. And that was really, for many years, the only symptom I had. So.
Kathy, with your stable angina, so it sounds like there was never a moment where the angina was bad enough so that you went to the ER, for example.
No,
it would come and go as you described. Yeah.
And I could predict what would cause it to come on and how long it would last.
Oh, wow.
So that was very, very stable.
So that's an extraordinary amount of control for something that could be potentially really scary, right? To have that chest pain.
But it was important to always, and doctors always asked, what's happening with that, and we'd always discuss it. And certainly I was always advised to be, look for, any changes in that angina.
Absolutely. So how did your doctor and healthcare professional team explain heart valve disease to you, and what was the information given to you or not given to you about heart valve disease that perhaps you wish that you had been given?
Sure. Again, we really had focused on my coronary artery disease and preventing another heart attack for, several years. Until we ran that echocardiogram and the aortic valve disease showed up. And his explanation to me at the time was very helpful. He talked about how while valve disease isn't talked about as much and maybe isn't as common, and particularly at that age, I was in my early 50s then, he said it's not really thought of, for people at that age as much, but that, he talked about it in terms of being as dangerous or even more so than anything that could lead to a heart attack. And he used the analogy of a garden hose, that if we think of a garden hose, and that at the end of a hose, that nozzle that you can open up or close down, that nozzle is our valve. And as that valve gets closed down, the pressure on our heart to try to pump that blood out, it has to work harder. And so as a result, if it's not treated, it can cause damage to the heart muscle itself. The pressure inside the heart can cause issues with the aorta and potentially an aneurysm. So he said it was something, he said, we're gonna watch this closely. The good news was from the coronary artery perspective, things were kind of stable. And so kind of shifted focus to that. and really started doing more regular echocardiograms, certainly monitoring symptoms. But even at that time, I wasn't having, I guess, classic heart valve symptoms. I still had that, stable angina, but it was still, behaving in the way it had been for, by that time, a number of years. So the other things were lifestyle, all the things that we should be doing with heart issues.
Yeah. Yeah.
And then medications to keep my cholesterol under control, and then also blood pressure. Fortunately at that time, because of the familial hypercholesterolemia, the drugs that I were on were working pretty well with my cholesterol, but not as well as the drugs that are on the market now, like Repatha.
Yeah.
These can really help with coronary artery disease.
Absolutely. So what was the turning point that led to an intervention finally? It sounds like your cardiologist was basically employing the watch and wait strategy. And so what was the moment that you both agreed that it was time to intervene?
Well, it was really, doing those ongoing echocardiograms and watching, some of those key measures. I still was not having any symptoms, but both the pressure inside from the valve, as well as the size of the valve, or how far it was closing down. They continued to monitor that, and it got to the point where it, clinically went from moderate to severe. And so then we started talking about interventions.
So it's really striking to me that you didn't have too many symptoms, and I wonder if you chalk that up to you already living quite a healthy lifestyle, right? Like, so if there's a question here about can you look back at your symptoms and think about whether they develop gradually? What I heard you say is, I didn't really have that many symptoms. It was really on the imaging and what had changed on the imaging that you decided with your cardiologist that it was really time to intervene.
That's true. I would say, probably it was at the time the decision was made, it was both the imaging results, but then I also did have a change in symptoms where I had a kind of a new type of chest pain emerge, which was different. It felt very different from the stable angina that I had for years. Yeah. This was more of a kind of a cramping ache kind of feeling that would come on sometimes not as a result of exercise or any type of exertion. So it was really the combination of, that change in symptoms as well as the imaging results. But again, I didn't have a lot of the other symptoms of heart valve disease, but certainly those two. And so that combination at the time, I had another echocardiogram, and then they had me do a stress echocardiogram, that combination of a stress test, and then they do an echocardiogram right at that time. Right after, I also then had right and left catheterization. And so from that informed the recommendation to do a surgical aortic valve replacement, and while they were in there, do a couple of coronary bypasses as well.
So I know that you were hoping you might be eligible for the TAVR, right? A less invasive version of valve disease, a valve replacement, but ultimately you required the open heart surgery as you just described. What was that decision like for you in terms of making that call? Did you even, was there even a choice in the matter, or was it clear that you really, based on your symptomology and your history, you really needed to have the open heart surgery in the end?
There was a choice. And that's where, again, I credit the cardiologist that I found out here in Northern Virginia when my husband and I relocated out here. I credit him with really helping me through that decision-making process, because I had, been, my former cardiologist had said, 5 to 10 years, you're going to need something to be done. And he was right about everything. And right at year 7, it was time. And as we were going through that monitoring phase, I would kind of pay attention, because like everything, there were advances being made on TAVR. And, because I'd been to the cath lab so many times, that was somewhat familiar to me. And I thought, okay, well, if I have to have that done, that would be an okay way to have it done. During that time, I remember seeing an article that Mick Jagger had TAVR. And I saw him in concert afterwards, and the way he was running back and forth across the stage, I thought, he's doing well. And if it's good enough for Mick Jagger, it's good enough for me. So I kind of had it in my head that when the time came, that's the way I would hope to have it done. And when my husband and I relocated out here, I looked for a cardiologist who did a lot of TAVR, and, again, thankfully found one. Unfortunately, my heart had other ideas. And as I think back on it, I think the key thing for me was, again, talking with my cardiologist. He really looked at it not only how to fix the problem at hand, replace the valve, but also set me up for the future. Yeah. And the way he explained it to me was, my valve was such, he had a good medical term. My term is gnarly. It was just, very stenotic, and just, there wasn't much they could do with it. And his concern was, if we just do a TAVR over that, we might not get a good seal, and the valve being not a good fit, not a good seal, and you might have, some problems. And because of my age, I was still, relatively young, that the assumption is if I do a biovalve, which I did, that it might need to be replaced at some point. So doing it surgically would set me up to have a good valve placement, so that if they had to do a TAVR over that or another valve via TAVR in the future, I'd be a good candidate and in a good position for that. And so I'm really grateful to him that, he kind of helped me think through it that way. Because otherwise I probably would have been, focused on, okay, let's just fix the problem in front of us and not be thinking for the future. All that said, I did end up getting a second opinion, and I did do some research. There's, some, unlike when I first became a heart patient in 1999, there's much better information out there to review and to try to help get me, I guess I would say, settled with the decision. But again, ultimately I decided to go the surgical route.
It strikes me there's a lot of new lingo in clinical practice around shared decision making, Kathy. And it sounds to me like what you and your cardiologist kind of undertook was like a master class in shared decision making, right? He seemed to really give you a lot of information, told you why he thought one was better than the other. You got a second opinion so that you were able to feel confident in the decision, and to be able to look back and have had a hand in that decision making. Ultimately, I'm sure has also contributed to the good outcome that you've had, which is, I think, the whole point of this idea of shared decision making. So I'm pleased for you, pleased for your cardiologist that it worked out that way. So after your surgery, what kind of information and resources were available to you? And then what wasn't available, and what did you wish you might have had at that time?
Sure. Again, felt grateful. I feel like I had, was well resourced. And I realized there are challenges sometimes because of insurance with all of that. But I was able to take advantage of, because I had a delay before I could start cardiac rehab. I did have some physical therapy come into my home. But when I was ready, when it was cleared by my surgeon to go through cardiac rehab, I did. And, for anyone looking at, just coming back from any eligible cardiac event, but certainly open heart surgery where you have those sternal precautions and all of that, cardiac, I just can't, I can't recommend highly enough going through cardiac rehab. It really helped me get my confidence back, as well as my stamina. And I just can't, recommend it enough. And the other piece I would say is support like you can get, through WomenHeart, being able to talk to another person who is going through it or has been through it. In my case, I actually was able to go through it with my sister. She went through open heart surgery the week before I did. And so we were kind of our own little support group. Yeah, we've got bad genes in our family. And but it was tremendously helpful, that idea of being able to talk with someone, hey, I'm experiencing this, are you having any of that? Or just the, times when you just need to vent because you may not be having a particularly good day. We helped each other through that process. And I'm so grateful to her. And I think it's so important for people to have that support. And cardiac rehab is just a must, I think.
I absolutely second that. Cardiac rehab is equal parts physical and mental, isn't it? That's what you sort of describe, and getting your confidence back, and getting your stamina back at the same time. So as we close out here, Kathy, I'd like you to speak directly to the women watching. What advice would you give somebody who assumes that their current diagnosis, or, simply getting older, explains away all their symptoms? What might you suggest, for somebody who feels something new and different, that is, that is not like what they've experienced before?
Well, just 3 words: don't assume that. Because for me, I've made the mistake, certainly, at the beginning of my heart journey, when I was in my 30s, of writing it off to, I'm too young, and I'm too young to be having anything wrong. Even though, looking back on it, I was having some symptoms. I just thought, oh, I need to get more exercise. I need to get in better shape. So I discounted it then, and then fast forward to now, in what seems like a nanosecond, but not. Fast forward to age 65, I don't want to make that same mistake, and of discounting symptoms just because I'm getting older. Because you're right. I think the blessing of being at this stage in life is that we've been rambling around in these bodies now for a while, and we know our bodies better than anybody, and so I think we also, at this stage in our lives, deserve to feel our best at whatever whatever that looks like. And so certainly, as in my case, if one has symptoms that change, or if they're new symptoms, don't ignore, I'm just getting older. And especially if there's history of any heart issues for yourself or for members of your family, or if you have things like high blood pressure, high cholesterol, and sometimes I think there are clinicians out there who may say, well, you're getting older. And that, I think, is where we have to be ready to advocate for ourselves, because we deserve to be feeling our best. And sometimes we can be, I think, our own worst enemy.
Absolutely.
Myself, oh, I'm getting old, or maybe something I just don't want to deal with, so it's easier to just ignore. But it doesn't serve us well. And so I've kind of gotten to the point where I'll think about it. Well, if in doubt, I'm going to bring it up to my doctor, and let him or her decide if something is clinically significant. And maybe it's heart related, maybe it isn't, but see if it's something that needs to be investigated further. And also, if we don't get a satisfactory answer, to continue to push or ask for a second opinion, or if need be, also look for a different clinician if there's someone that, again, just isn't working with us in the way we deserve to be worked with and treated.
Absolutely. And what we know about valve disease is that we know that there's disparities between men and women in terms of diagnosing heart disease in general, but that difference, that delta, that disparity is even more pronounced in valve disease. And so there's a particularly important rationale for bringing this up with our doctors when we do have symptoms that don't feel right. Really, really important to do that.
Push for that echocardiogram if you think that valve disease is a question. It's an easy test.
Yeah, absolutely. Kathy, thank you so much for participating in this conversation today. Congratulations on your anniversary. It's an incredible milestone. And we're so grateful to all that you do for women out there, and for WomenHeart, and through WomenHeart, using your voice and your story to advocate for better outcomes for women. So thank you to you.
Well, thank you, Celina. I appreciate it.
Yeah, absolutely. So I think, today's key message is pretty clear. Heart valve disease requires imaging for diagnosis. I think we heard that loud and clear, certainly as illustrated in Kathy's journey. Symptoms that persist or progress deserve evaluation, even if you already have a heart disease condition. There might be something else going on, again, like in Kathy's case. Women's symptoms should not be minimized, especially when they represent a change from baseline, from what you have known in the past. And I think, especially when we listen to Kathy's story, this is where it really, really pays to listen to your body, to know your body well, to listen to your body, so that you can make that distinction between what's my normal and what's not, what is different. And you're only going to know that if you're paying attention to the day-to-day rhythm of your body. If you're experiencing shortness of breath, decreased stamina, dizziness, fainting, swelling, a noticeable change in what you can do exercise-wise, please tell your doctor or healthcare professional. And if you already have a heart condition, some form of heart disease, but your symptoms change, as well, tell your doctor or healthcare professional. Explain your symptoms clearly, write them down if you have to, so that you can explain clearly to your provider once you go to your appointment, and advocate for yourself so that these things don't get explained away as, we're just getting older, or it's just more of the same in the past. I want you to all join me in thanking Kathy Larkin for this important conversation, for sharing her story with us. We also at WomenHeart want to thank the Alliance for Aging Research for their partnership in recognizing Heart Valve Disease Day. Please go to valvediseaseday.org to learn more and to access additional educational resources. For resources on getting a timely and accurate diagnosis and guideline-directed care, go to womenheart.org for our Treat Me Right resources, which is all about getting a timely diagnosis. You can also learn more about heart valve disease and connect with support there, as Kathy described. We know this, and I'm going to repeat it again, earlier diagnosis can change outcomes and can indeed save lives. So thank you all for joining us.
Thank you.